Good evening. In this video, we will discuss all the screening tests which are more likely to be tested in the USMLE Step 2 CK. So let's start with the hypertension. The hypertension we screen in the patients 18 years or more than that, older than that. So the first we do the office BP measurement. But if the patient is diagnosed as the hypertension, before starting the treatment, we'll just go for the ambulatory BP monitoring. Only then we'll give the treatment. So if the patient is black, then start with the calcium channel blockers or the thiazide. But if the patient is white or non-black, then start with the angiotensin converting enzyme inhibitors or ARB inhibitors. Breast cancer screening. So we do in the patient age 40 to 74 years, and we do it biannually. The test is used mammography. Another one is the cervical cancer screening. In this, we start from 21st to 65 years of the age. So if the patient is 21 to 29, start with the PEP test, and we do it every 3 years. 30 to 65 years of the age, PEP test is used. Then every 3 years we have to repeat. If HPV is tested every 5 years, we have to repeat, and PEP or HPV every 5 years we have to repeat, because this is a co-testing. So if the patient is having HIV, then after the diagnosis and the onset of the sexual intercourse, we have to do it annually. Immunocompromised patients, we will do the co-testing with PEP and HPV, and we'll do annually. Lung cancer screening, we have to start from the age of 50 up to the 80 years we can do, and this is in the annually. So lung cancer we do in the patients who have smoking history greater than 20 years, or who have quitted the smoking within the 15 years. It's not been 15 years. If it's been more than 15 years, then the lung cancer screening is not required. The test used is low dose CT scan chest. Another one is the hepatitis screening. So for the hepatitis C, we have to do all the adults who are 18 to 79 years of the age. Hepatitis B, we have to do in the first trimester or first prenatal visit of the pregnant women. Abdominal aortic aneurysm, we have to do once in a while in the patient who have smoking history. So 65 to 75 years of the age of the men, and the test uses the abdominal ultrasound. Osteoporosis we do in the patients who are preferably women and 65 years of the age or older. If you want to do it less than 65 years, then the patient must have the postmenopausal women. Increase the risk of the osteoporosis. So the test we use is bone mineral density scan or the DIXA scan. STIs. So there are two STIs we have to screen: chlamydia and gonorrhea. These both we can screen in the patients who are sexually active in the age of the 24 years or younger age. Women 25 years who are 25 years older who are at increased risk of the infection. And we have to give the prophylaxis for gonococcal ophthalmia neonatum to all the newborns with the topical medication. Colon cancer screening. So colon cancer screening is done via multiple methods, but the age is 45 to 75 years of the age. Most commonly we use is the colonoscopy, and for the low average risk patient, start with the 45 years and repeat every 10 years, but the patient is with high risk or first family member is diagnosed with the cancer, then start with the 40 years of the age, or 10 years early, then the first family member first degree relative have diagnosed. Like if the first degree relative has the cancer at 25 years or 35 years of the age, then we have to screen in the 25 years of the age. So we have to repeat every 5 years. And the sigmoidoscopy we have to do every 5 years or every 10 years if we are doing with the FIT. Lipid disorder, we have to do all men 35 or older, and if it's women, then 45 or older women. So age 20 plus for those who are at the increased risk of the coronary artery disease. Pre-diabetic and type 2 diabetes screening. So we do at the age of the 35 to 70 years in the patient who are obese or overweight. And for the gestational diabetes, we do at the 24 week of the gestation or after, and just use this 1 hour glucose tolerance test. Major depressive disorder, we do in the young age in the patient 12 to 18 years. For the adult population, pregnant women, postpartum persons or older patient, all require the major depression screening. Anxiety disorder, if the children then start from 8 to 18 years, and if older then start from 65 years or younger, so including pregnant and postpartum persons. So CVD, here are two screening guidelines, though these both are different. So the first screening guidelines are about the aspirin use, primary prevention of the CVD. So we use in the patient who are 40 to 59 years of the age and are at the 10% risk of CVD, or who have greater than 10 years of the CVD risk. So this is totally low dose aspirin is totally individual based. So next is the statin. This is also used for the primary prevention of the CVD, and this CVD, and the age is 40 to 75 years of the age. So who have one or more CVD risk factor like the dyslipidemia, diabetes, hypertension or smoking, and have the 10 years risk of CVD events to occur. Asymptomatic bacteria we have to do in the all pregnant persons and via the urine culture. HIV is done in the all pregnant persons, those present in the labor or at delivery whose HIV status is unknown, or adolescents or adults in the age of 15 to 65 years of the age. So who basically should be tested for HIV? The men who have sex with the men. In IV drug abusers, person who exchange sex for money or drugs, or sex partner of persons who are HIV infected by sex or injected a drug, or person who have sex with partner whose HIV status is unknown. So the test used is enzyme immunoassay or anti-gene antibody immunoassay. So the next one is the intimate partner violence. So all women of reproductive age provide to screen with this IPV, and RST blood typing and antibody testing. So all pregnant women during their first trimester, their first visit, are required to screen for the RST blood typing. So the next, we have to repeat the RST antibody testing for all unsensitized negative women at 24 to 28 week of the gestation, unless the biological father known to RST mother is negative. So pre-eclampsia prevention. So according to USPSTF, we have to use the low dose aspirin, and after 12 weeks of the gestation, who person are at the high risk of the pre-eclampsia. So for the obesity, we will screen in the patients who are 6 years or more older than that. So according we know about this folic acid, we have to do give the patients before planning the pregnancy. So start before the conception, and pregnant women have to take 0.4 to 0.8 milligram of the folic acid in the daily supplementation. Alcohol use, we have to screen from 18 years to older, including the pregnant women. For the visual screening, start from 3 to 5 years of the age to detect the amblyopia or increases factor. So thank you. That's all about this screening. I hope it was helpful.